I welcome the opportunity to talk, however short today. And again, I just want to put it in perspective for Galway City. And I'm very conscious of what the former Taoiseach was saying in relation to improvements. I acknowledge improvements. I acknowledge the extra consultant contracts. I acknowledge the abolition of the charges and so on. However, what we have is a jigsaw of pieces with no overall picture of universal care. And there's a background to that, and it's deplorable really that we've made very little progress in it. And so when I speak here today, yesterday there were 41 patients on trolleys, and I ask again, which politician in this stall, including myself, ever spent any time on a trolley? Yesterday in Galway City, 41, today 48. No mention of that by the former Taoiseach or the government or indeed the speech. Now, how can we talk about universal health care if that's the position? 48 people on trolleys. I want to acknowledge what the Minister for Health has said in terms of acknowledging the amount of staff from outside of Ireland that are keeping our health service going and indeed keeping our hospitals clean. 1 in 2 of midwives and nurses have trained outside the country, 2 in 5 of our doctors, and it's important to recognise, given the deplorable discourse that's going on at the moment in relation to immigration. However, back in 1948, when we finally decided we were a republic, which became a republic in theory in 1949. But in 1948, the World Health Organization recognised the enjoyment of the highest possible, highest attainable standard of healthcare is one of the most fundamental rights of every being, without distinction of race, religion and political belief, economic and social condition. Why? On every level it's good for us. It's good for us on an economic benefit because it reduces the need for expensive emergency care and, of course, hospitalisation. It's better health outcomes. It's good for the common good in terms of solidarity, and it's good because of improved public health. Early detection and consistent care obviously can prevent problems. So on every level it's good. The World Health Organization, again, over the years since 1948, since we declared a republic, has repeated the message of the advantages of universal health care to ensure every individual and community, irrespective of their circumstances, should receive the health services they need, not based on money. And then we move forward and we go forward to 1978. Remember now, we've jumped from 48 to 1978, and the declaration of the Alma-Ata Conference on Primary Health Care recognised health and access to basic healthcare services as fundamental, and to quote the World Health Organization. Despite that, Ireland remains an anomaly in Europe in not providing universal health care. Then 2011, first time ever, the government commits to universal health care financed by universal health insurance. Not quite in agreement with that, but it was a major, major step. Nothing happened. The reform was abandoned. Fast forward to 2016, when I came in here for the first time, the all-party committee made progress in terms of an all-party policy. Very little has happened since. So what we have now is a fragmented health service, following from a PD philosophy of making products out of everything and selling it. Just today, in addition to that trolley figures, I've been on the phone to somebody who knows, just anecdotal, but again, it's actual reality, through the privatisation of our public health services, had treatment up in Belfast, comes back, is in trouble in Galway, and is told to go back up to Belfast because that's the doctor in charge now. We've utterly fragmented our service, and in Galway City, while that amount of people remain on trolleys, the Clifton Hospital is closed. And I'll just finish on a tangential but very important thing, Cancurlan. I'm aware I'm over time, and I'll be as quickly as I can in relation to vulnerability assessments for those vulnerable people that are coming into our shore. An absolute legal obligation on us to carry out vulnerability assessments. They are not being carried out. And the last time they were carried out, 4,901 assessments took place over a 3-week period. Remember, they're not happening anymore. And at that stage, 2,712 were deemed vulnerable coming into the country, and we've utterly stopped it.